नमस्कार, मैं पूजा। स्वागत है आपका हमारे यूट्यूब चैनल साची बात में। जैसा कि हमें अक्सर सुनने में आ रहा है कि वर्तमान समय में हार्ट अटैक जैसी बीमारी बहुत ही सामान्य हो गई है। आज के समय में हार्ट अटैक से होने वाली मृत्यु दर लगातार बढ़ती ही जा रही है, जिसमें युवा वर्ग और कम उम्र के लोग भी शामिल हैं। आज के इस वीडियो में हम आपको बताने वाले हैं हार्ट अटैक के बारे में, और इसके लिए हम देखेंगे दिल्ली के हार्ट स्पेशलिस्ट डॉक्टर अनिर्बान कुंडू का इंटरव्यू।
Hello friends, I'm Dr. Anirban Kundu, Senior Consultant Cardiothoracic Surgeon at Sri Agassan International Hospital, Rohini. Today I'm going to talk about the reasons for an increased incidence of heart attacks in the winter and what we can do to prevent it. Now, the very basic reason for having an increased incidence of heart attacks in winter, which we see very commonly in our practice, is the very fact, the phenomenon that blood vessels tend to constrict or go into spasm in response to cold temperature. This is a normal physiologic response of blood vessels. So the moment someone enters low temperature zone or simply goes outdoors where there's a marked fall in temperature, there will be a sudden constriction or spasm or narrowing of the blood vessels. Now, if someone has a pre-existing cholesterol deposit or partial blockage of his coronary arteries, that logically, the moment he enters a low temperature zone, the artery gets constricted, leading to a further cutoff or further acute reduction in his blood supply to his heart muscle, and that leads to a heart attack. Now, which is why whenever we go out in the cold in the winters, whether or not we're heart patients or especially those people who are at risk for developing heart disease like diabetics, hypertensive, smokers, we first have to acclimatize ourselves before going out. That is, we should keep ourselves warm and exposures to low temperature without adequate protective clothing. Now, the ill effects of cold weather are exerted in two ways. First, as I mentioned, the sudden constriction of blood vessels along with a pre-existing block can cause an acute cutoff of blood supply leading to heart attack. Plus, it's not just the heart blood vessels that get constricted. All the blood vessels of the body get constricted in response to cold weather. This leads to an increased resistance against which the heart has to pump blood to the rest of the body. So in two ways, we have the heart at jeopardy. First, the coronary blood vessels that supply the heart get constricted. Secondly, the heart has to work at a higher than normal resistance to pump blood all over the body, because now the arteries into which the heart is pumping blood have become constricted. This leads to an increased workload of the heart, which itself is suffering because of its own vessels getting constricted with an underlying pre-existing lesion, partial block, and that is a surefire recipe for a major acute heart attack triggered by the cold weather. Now, logic dictates that the way to prevent this kind of situation is keep yourself warm and obviously if you could avoid going out into the cold, it would be good. And if at all we're contemplating exercise, we must first do an adequate warm-up. Warm-up has the effect of dilating or opening up the blood vessels, which will to some extent counter this sudden constriction that is caused by low atmospheric temperature. So if we do a proper warm-up prior to exercise, even if it's a cold weather, the arteries will already be dilated to a certain extent and will not have such marked constriction when we start exercising in cold weather. Of course, the best thing would be in extreme cold weather, try not to exercise outdoors and exercise indoors in a temperature that has a reasonable comfortable zone, 20-25 degrees, so as to avoid any major constriction of the blood vessels. Another way this causes a heart attack is if you already have a cholesterol block in the blood vessel. When the blood vessel constricts, that cholesterol plaque ruptures, and due to that rupture there can be a clot formation right there, causing an acute cutoff of the blood supply to that particular heart muscle, leading to what we call a heart attack. So the best part is prevention. Do not expose yourself to cold, or at least do an adequate warm-up before surgery, before exercise, consume warm fluids, warm foods, keep yourself as warm as possible, and do as much indoor activity as possible, especially if you have heart disease or prone to developing heart disease.